Hi there, Mrs. Jones. How are you doing?
Good.
Good. My name's Cassie. I'm going to be your student nurse today. I'm going to go ahead and wash my hands. Would you mind giving me your full name and your birthday?
Yeah, Betty Jones, 9/23/44.
Perfect. So today we're going to be doing the doctor has ordered for us to do a dressing change on your central line. He wants us to drop some blood from it, and then he also wants us to do the cap change after you drop your blood.
Okay.
So how long have you had your central line in?
6 months.
Okay, so you've had it for a little while.
Mm-hmm.
Do you feel like you're getting pretty familiar with how your dressing changes and everything works?
Yeah, I feel pretty good about it.
Okay, good. Well, don't worry, I'll explain the whole thing the whole time. That way, if you have any questions, you're welcome to ask me, okay?
Thank you.
Okay. Alright, do you have any allergies or anything that I should know about, Ms. Jones?
No.
Okay. Alright, have you had any pain or anything with your central line lately?
No.
Okay. Well, during today's procedure, if you have any pain or anything, you just let me know, okay?
Okay.
Alright, I'm going to go ahead and put my gown on. Alright. So, do you know how often we are supposed to do our dressing changes?
No, not really.
All right.
I don't remember.
So, we do our dressing changes every 7 days is when it should be done, unless it gets soiled or starts to come off really bad or gets kind of gross. So, if I go ahead and change your dressing today, when is the next time that you think we will change it?
You said 7 days are dirty, so a week or unless it's dirty or wet, right?
Yeah, perfect. That is a good answer. All right. So part of this procedure that we do today is a sterile procedure. So do you know what that means?
Keeping things really, really clean to make sure no germs?
Yeah, kind of. That's basically the whole idea of it. So I figured I'd put a mask on you. That's for when we go ahead and do the sterile part of our procedure.
Okay.
So and I'll let you know before we start, but during that part, I'm going to ask you if you need a cough or anything, I'm going to have you turn your head to your left because your central line is on your right. I'm going to ask you to cough into your mask, and I'm going to ask you to hold really still.
Okay.
Okay? All right. So I'm going to go ahead and I'm going to start by taking off your dressing you have on now. This is not the sterile part, so don't have to hold extra still or anything yet. So this is just an alcohol swab. I'm just going to rub it around the edges of your dressing here so that we can make sure it doesn't stick to you too bad.
Okay, thank you.
No problem. All right. There we go. I'm going to pull towards your insertion site and make sure we don't pull on your line. I'm going to observe for any redness, discoloration, foul odors. Do you have any pain or anything while I'm taking this off?
No.
Okay. See that there's no discharge or anything on here, so I'm going to go ahead and take that off with my gloves. That's that. Alright, and then in between each procedure we need to do hand hygiene. So if anyone forgets, I want you to remind them, okay?
Okay.
Okay. So now we're going to start the part of our procedure that's sterile. Do you remember what that means?
I'm not gonna move, and if I need a cough, I'll turn my head to the left to make sure I cough in the mask.
No problem. I'm gonna have you turn your head to the left anyway, just to be safe, okay?
Okay.
But go ahead and now we're gonna be extra still.
Okay.
All right. So I'm gonna go ahead and open my brand new kit here that I have. And toss that. I have my own set of gloves right here. step away, put them on. Okay. All right, so I don't need this anymore. I'm gonna go ahead and clean up this. I don't need that. I don't need that. And I don't need that. Okay. So, I'm gonna go ahead and I'm gonna break this. I'm gonna secure your line here and then I'm gonna go ahead and clean this. Are you still doing okay, Mrs. Jones?
Yes.
Okay. Make sure I clean all the area really well. Clean up the line. Make sure, I mean, if there's any extra blood or anything, I do have a alcohol one in there too that I can clean it up with. Done with that. Okay. Go ahead and get my Tegaderm here. I'm gonna have to use this hand to help me. Go ahead and just put that right there. Okay, now I'm gonna use my other hand because this is all good now. There we go. Sometimes the paper is a little stubborn and doesn't want to come off very well.
Yeah, other nurses say that too.
Yeah, it happens. All right, so I'm done with this sterile part. And then normally I have a little tag right there that I can put on there that has my initials and what time I did this on and everything. There wasn't a little tag with this one, so I'm gonna go ahead and make my own. Okay, that way they know that I did it at this time and this is the next time it should probably be changed, okay?
Okay.
Okay, so you can relax a little bit now. I'm gonna just go ahead and clean up my area here.
All right.
Go ahead and take my gloves off. All right, and then hand hygiene, right?
Yep.
That's right. Okay, so the next part of the procedure we're gonna do is we're gonna go ahead and draw some blood and we're gonna do your cap change on the top of your central line. Does that sound good?
Mm-hmm.
Okay. Just want to make sure it's stuck down there. Okay. So I got all my supplies here that I need. Get them all lined up. Okay. Some alcohol swabs. All right. Just a little more hand hygiene real fast. Okay. Now put my gloves on. Are you still doing okay? No pain or anything? Or
No.
are you feeling nauseous, anything like that?
Nope.
Okay, that's good. I'd like to hear that. All right. Okay. So I'm going to start off, I'm going to clean the top of your cap. And anytime anyone comes in and they're going to do anything with your central line, you remind them to clean your cap for 15 seconds.
How long again?
15 seconds.
Okay.
Okay. Clean. Okay, I'm actually going to switch hands here. Okay. So this first one is just a little flush. Some just normal saline here. I'm going to unclamp it here. And then we're going to flush it using positive pressure.
Okay.
We're going to do 10 milliliters.
What's positive pressure?
Positive pressure is kind of, we're going to like push it in a little bit and then stop. And then push a little bit and then stop.
Why do you do that?
It helps to make sure there's nothing clogged up in your line, and it helps that we make sure it's nice and patent and clear. So when we go ahead and draw blood, then we know it's all nice and clear, and if we need to give you any medications.
Oh, okay.
All right, it's still clean, so I don't need to clean it off again. All right, so this first little bit of blood we're gonna do, we're just gonna waste it. And we're gonna do that because we just injected some saline and it'll dilute the blood that we get back out.
Okay.
So we're just gonna waste 5 milliliters. Okay, and then this would go in the sharps or the biohazard, depending on where you need to go. Okay. Still clean. Got my needle as a cap here. And now we're gonna draw out the blood that we're gonna use. Okay. And our vial only needs 4. So we're gonna draw just a little more than 4 just in case. Okay. All right, I'm gonna set it down now. I'm gonna go ahead and clamp that back. Uncap it. All right, and then here is our little vial. Perfect, okay. I'm gonna save it, and then that will go into the sharps. So this one, I'm gonna go ahead and I'm gonna put your name and my initials and the date and the time. And I'm gonna get this to my CNA and she's gonna take it down to the lab so we can get that taken care of.
So what did you put on it again?
I put your name, of course your name and your name and birth date and everything needs to be on there. And then I have my initials and today's date and the time I took it and all that good stuff.
Okay.
Do some hand hygiene here. All right, so now we're gonna go ahead and we're gonna change the cap.
Why are you doing that?
So typically your cap needs to be changed every 7 days, or unless whenever we draw blood.
Okay.
And we do that because there could be blood left in my glove's not working with me. Because there could be blood left in the cap, and we don't want that to dry and get clotted up or anything, because that would be bad.
Oh, okay.
So that's why we're gonna go ahead and just change the cap out real fast. Plus, it's been 7 days since we need to change your dressing too.
Mm-hmm.
So, when do you think the next time we'll change your cap will be?
In a week, unless they do a blood, right? Draw blood?
Blood, yep. And there's some other reasons why they might need to change it more often. I don't think they pertain to you right now, but I will look those up and let you know if you have any questions about them.
Okay, thank you.
So, I don't need to clean this because we're just changing it out. So I'm gonna take this off. Okay. Dispose of that. I'm gonna observe to make sure there isn't any blood or anything like that, and if it is, I can always clean it off. Attach that. I'm gonna unclamp this. Make sure it's nice and tight. And then I'm gonna flush another 10 milliliters using positive pressure to make sure that your line is still nice and patent, or what that means, or make sure that it's clear.
Okay.
Okay. Good. Okay. And then that's still nice and clean because I haven't touched anything else with it yet. All right, I'm actually going to set it down, so I will clean it again. And how long should I clean it for?
15 seconds.
That is perfect. You are a good student.
I'm so old, I don't think anybody's called me a good student in a long time.
We're always students, always learning. All right, almost done here. I want to make sure it's nice and clean. Okay. I'm going to hold it with this hand. Just going to take that off. And what I'm going to flush it with now is heparin. Do you know what heparin is?
Yeah, I think I've had to have that before when I've had surgery. It's something to do with clots, right?
Yeah, we push the heparin through to make sure, and we're using positive pressure, of course, so that there's no clots or anything building up in your line.
Okay.
Just a good little extra right there to make sure we're good. Okay. Take that off, get rid of that. And then we're going to change out your tape here real fast too.
Okay.
I have a nice piece of tape right here. Okay. And you are all set. Do you have anything you want me, you need some ice or a drink or anything before I go?
No, I'm good.
Okay. I'm going to clean up my area. I see you got your collet right here. And you are good to go. Let me know if you need anything.
Okay, thank you.